Bismillah ar-Rahman ar-Rahim. I'm Dr. Salman Khan, practicing in Islamabad and Peshawar. I'll be very brief and very quick. I'll start off with please play this video. It's not working.
Every search for a hero
Music.
must begin with something that every hero requires.
It's a scene from Mission Impossible.
Therefore, in a search for our hero, Bellerophon, we created a monster. Chimera.
I'll come to the line, the reason why this video was played. Every search for a hero must begin with something that every hero requires, a villain. Villains are actually the complications of hair transplant. Everybody would want to be Elon Musk with very pretty hair, but they would forget the past. This is the villain. Post-operative edema, swelling, this another villain. They are the complications that you must be aware of. Bleeding, swelling, bruising, infection, folliculitis, necrosis, shock loss, you have the list in your books. I'll just briefly show you a slide with the complication and then how to manage it. With bleeding, you need to be very good with your history taking, hypertension, pre-op assessment, the use of tumescence, xylocaine with adrenaline, a good tumescent solution, and meticulous technique. Some people like to have a good post-op dressing as well. Post-op edema, a dreadful complication that happens and people upload it on YouTube. So no matter where the hair transplant happens, you will have to answer it in your consultations. What to do? Reduce the amount of fluid that you use. You can use triamcinolone, a steroid. You can reduce the amount of fluid and concentrated tumescence. Infections, just like any other procedures, can happen, and you know how to treat them. Topical, oral, IV antibiotics, some anti-inflammatories, and NSAIDs. Folliculitis commonly happens with hair transplant, can happen even after PRPs. You need to know how to treat them. You need to know how to avoid it. One way to avoid is every person who enters your procedure room must be trained. They must be trained on what to touch, what to avoid. They should be trained on how to treat a patient, how to do the scrubbing and the use of pyodine or povidone solution. Topical and oral analgesia. Now, skin necrosis. This is one thing which I would emphasize on, even with the less amount of time. If you go for concentrated solutions, you can end up with necrosis. If you go for very high density that your patients demand, increased number of follicles, you can end up with skin necrosis. It's a difficult thing to treat, and you need to have a plastic surgeon on board to help you out with this sort of complication. You need to understand the blood supply. You need to know the use and abuse of adrenaline, how much to use, what to avoid, the sites, the depth. Nobody really knows the precise depth of the follicle that you have to place in. 4 to 5 mm is the appropriate size. Early diagnosis. You need to have a very sharp eye to identify the problem at the early stage. You need to know about the blanching. You need to know why the skin is red, what is normal, what is abnormal, what's blanching, what's yellow, what's infection. You need to have a keen eye. Early diagnosis would save you because the patient is going to roam around the whole city and he is going to talk to everyone who is doing hair, whether that be dermatology or plastic surgery or aesthetic physicians. So beware of that. Shock loss can happen very commonly. Now when people want increased number of follicles, shock loss has increased. You need to know about the pathophysiology, and you need to know that it would resolve in the next 4 to 6 months. Telogen effluvium, you know about this. Keloids, difficult to treat, but luckily they are rare. So whenever you come across something like that, consult a plastic surgeon. Hypopigmentation can happen with FUE, can happen with FUT if you have not closed it very well. Take-home message, hair transplant may seem like a simple surgical intervention on the outside, but it is a difficult and complex on the inside. Learn, understand, and practice. Relearn, re-understand, and practice more. Now enough about the villains. I'll just quickly show you what you can do. You can be the hero, and you can be the creator of heroes. One of the patients who came up with type 3 to 4 baldness, I did about 4,000 grafts. This is him right after 1 year. Another patient, he had baldness in the crown as well as the front. Again, about 3,500 follicles, and you can see the result after 9 months. Finally, a third patient, he wanted increased density in the front. He looked miserable in the first picture, and this is the picture that he sent after a year. So these are the heroes that you can create, but be very careful with your knowledge. Thank you.